Welcome to my update on coronavirus and medical news, June 30th, 2020. I'm a family doctor and I spend most of my time communicating medical information to people. So that's what I'm trying to do today. So today I want to talk about masks. This is a cloth mask. People question whether this does anything at all for coronavirus. These cloth masks do not stop a virus particle from going through them. Just looking at the size of a virus particle, virus particles are somewhere between 50 and 300 nanometers. The coronavirus specifically, also somewhere, let's just say around 100 nanometers. Estimates may vary. A cloth mask really doesn't filter that small of a particle. So what does it do? Well, it stops respiratory droplets. So a respiratory droplet is something you can almost see. It's a little bit of the saliva that comes from your mouth or mucus that comes from your nose. Now, when you have coronavirus, and even if you don't know that you have it, you are shedding virus. And the main place that you shed it from is right here, the nose and the mouth. If you can cover that, a cloth mask can keep that close to your face and not out here. So if I cough, whatever I have in my mouth, my respiratory droplets can be projected 3 to 4 feet around me. A sneeze, maybe even a little bit farther. Just speaking, I can send respiratory droplets 2-3 feet away from my face. So when we have a mask on, it stays right in front of our face. So what's mine stays mine. So that's the value of that. There's other ones we call surgical masks. So a surgical mask, or just a medical mask, may fit a little bit better around the nose. It does allow easy breathing, but it's not airtight. It is better around the sides, so there's less air leaking around it. Now, people will also say doesn't filter particles small enough to filter out a virus. Well, yes and no. It depends upon the quality and grade of the surgical mask. There are different qualities and different grades. You really have to look at the box and see how far down it does block small particles. But some of these are good enough to block a lot of respiratory particles. Again, these are a little bit more water resistant on the surface, so if you do get a droplet on you, it's going to bead up and stay there. It's not going to soak through. So this mask does a little of both. It keeps what's yours, but also if you got an actual droplet on you, if somebody sneezed on you, it could actually keep most of that off of you and away from you. Not 100%, but one of these would block the majority of virus that you have from outside to in. So this does also protect you. Then there are the filtering face masks. Those are the N95 respirators. Now those have something different. I don't have one right now, but they fit very well around the nose, around the face, and to wear one properly you need to be fit tested. So they just check the size of it. They check to see if there's much leak on the sides of it. So that is a face respirator. That filters out very, very tiny particles. That goes down to as small as 3 to 10 nanometers, much smaller than a virus. So the N95 or face filtering respirators are very effective at filtering out viruses. In fact, probably 95% or more of all viruses are filtered by an N95 or face filtering mask. And those are used especially in the medical field and especially on COVID-19 floors. They must have those when they go into the rooms because there is virus that is circulating in those rooms when they go in. So for the rest of us, when we're just walking around, our odds of coming across somebody who has COVID-19 is fairly low. But probably the biggest risk is somebody who doesn't know that they're sick and they're carrying the virus around. And if they'll just put one of these on, they won't spread their virus very far. In fact, it'll stay right there. So that's really the benefit of that. So that it does work. Wearing masks and doing that as a public health policy, and that's why some of these things have to be mandated. If you just leave it up to everybody's choice, you're going to get very little buy into this and very little use. But when everybody uses it, we're going to decrease the spread of this virus just by wearing a cloth mask. It can be very effective. Okay, another concern. People are worried that these masks are going to inhibit the flow of oxygen and carbon dioxide. So, can wearing one of these make my oxygen level go down or my CO2 level go up? The answer is no. It's just not possible. These are not able to stop the flow of oxygen and CO2 molecules. Those are molecules. They are much, much smaller than what we're talking about with virus particles. And these masks are designed so that air flows through them. In fact, I was reading one study, it doesn't really tell the full capacity of these masks, but they were doing some studies on these masks and using 85 liters per minute flow. liters in a minute is enough airway flow for anybody. So you can get plenty of air through these, and you're not going to stop oxygen. Oxygen is going to be the same inside the mask as outside the mask. If you sample it, it's going to be 21% inside, it's going to be 21% outside. Carbon dioxide, the same percentage is going to be the same inside as outside. This is not a membrane that is going to cause a differential between oxygen and CO2 on either side of this mask. So some people might feel like, well, it inhibits my breathing. Again, you can get plenty of flow through one of these. Talk to any surgeon or nurse or surgical tech that's worn these for hours on end to do a surgery. They don't pass out, they don't become hypoxic, they don't have CO2 levels increase. The other concern would be with children. Can they wear a cloth face mask and not be harmed by it? The answer is yes, they can. Again, there's not going to be any change in their oxygen or CO2 levels. Children can wear these. Now, will they and can they be taught to keep it on? That's difficult. I agree. It's going to be a challenge to teach kids to wear these, especially if we decide to have them wear them at school. But they can be worn and they can be worn safely. Another concern, what about bacteria and other viruses that get on the inside of this mask and then I keep them next to me and I get infected? It's possible, but if it came from you to begin with, you already have it. You need to change these out. You shouldn't use one of these more than one day. When they're in short supply, using one for the day is not a bad idea, but you should change out a disposable surgical mask pretty much every day. A cloth mask, you should just wash it. Have good hygiene, and you won't have to worry about infections coming on there. Some people worry about it stopping their immune system. It really doesn't do any of that. None of those things. They're safe to use, they are effective. And it's also, if you think about wearing a cloth mask right now, this is keeping, if you possibly have the virus, it's keeping you from spreading it to somebody else. This mask is being considerate of other people. This mask, when I go into stores, restaurants, I was wearing it before it was mandatory because I didn't want to expose people to something I might be carrying around. Another thing that I've enjoyed seeing is people becoming a little stylish with their mask and maybe even making a statement. I'm an OU fan. I'm from Oklahoma. Here is my stylish OU mask. But whichever cloth mask or surgical mask that you wear, understand that they are effective at preventing spread of the disease. They are safe. You will not build up CO2 or lose oxygen levels, and it is a considerate thing to do for those around you.